Hi, good morning. At Oklahoma Spine and Orthopedic Institute at Hillcrest, they use computer-assisted technology during surgery. That's just one of the ways that they offer comprehensive surgical rehabilitation and therapy services. We're so happy to welcome Dr. Yogesh Mittal of the Orthopedic Center here this morning. Thanks for coming in today.
Thanks for having me.
Okay, when we talk about knee and hip replacements, so many things have changed over the years, and I'm sure it's gotten so much better. Kind of break down the surgery and your process.
Well, as you know, or you may not know, the first baby boomer turned 65 this year. And so a lot more patients are needing hip and knee replacements, are getting younger, and we have to be better. It can't just be about just, oh, they have the surgery, the pain is gone. We have to be better. They want to go back to work, take care of their grandkids. And so the techniques have gotten better, the implants have gotten better. They're much more conforming in the hip and the knee. And we're much more minimally invasive in the surgery. We are more muscle sparing when we do the surgery. Especially in the hip, there's an anterior approach now where we go in and we actually go between the muscles and not through the muscle, so patients can recover a lot faster. So there's lots of new things that are coming about. The implants that we use, the polyethylene, they're wear resistant, so they last longer. Lots of new exciting technology.
And we mentioned computer technology. How does that play a part in this?
For me, I use computers in surgery, and it's like a GPS in the surgery. So we basically take points during surgery and we create almost a 3D model of the knee or the hip on a computer screen. So we can customize that surgery, those implants, and where we put them in for the patient very precisely. So it's very accurate, and it helps me do better for the patients.
Now, what are some of the big concerns that people have when they're going into a surgery like this? Because it sounds overwhelming. I mean, it's such a big deal.
Well, it is. It's still a big surgery. I mean, hip and knee replacements are considered a major surgery, and so they have to be medically cleared. Their heart and their lungs have to be strong. They have to see their primary care doctor to make sure everything is okay for them to have the surgery. And the rehab is very, very important for the surgery.
Because if the rehab doesn't go the right way, would you have to go back and have the surgery over again?
Sometimes you have to do more surgery, or you have to do certain things to manipulate the leg or the hip or the knee. But absolutely, the patient plays an integral part in the recovery.
Now, you are the expert surgeon. Do you also have people that guide them through the rehabilitation to make sure that they're okay with their rehab?
Absolutely. We work really close in hand with the physical therapists, and so they are very important. Just immediately after surgery, they start seeing the patient in the hospital. When they go home, they have therapists that come to their house, and then outpatient therapy is also very important.
Okay, now you're also the medical director of the CORR program. What is that?
The Center for Orthopedic Replacement and Recovery. Okay. And so it's a joint program, and it's at Hillcrest, and the idea is it's a very patient-friendly program that incorporates the whole joint replacement system from start to finish, as far as when they come in, preoperative education, then they have the surgery, then the therapy that's involved with it, the case managers that help them make sure they have everything at home that they need, and then the follow-up afterwards. So it's very comprehensive.
And is that how it is a hospital within a hospital? Is it just because everyone is there, or explain how that is?
Well, that's exactly what it is, but it's all on one floor, and so it's a new part of the hospital. The patients come in, they come in to have the surgery. The surgery's on the same floor, the recovery's on the same floor. The rooms are all private, all in one area. The therapy is just down the hall from that. So it incorporates all in one area, and everybody goes to the patient. They don't have to go anywhere for it.
And if I was to have a hip replacement after surgery, what's the recovery time like these days with the new technology?
With the new technology, especially anterior hip, we start immediately weight bearing, so they can start walking right away. But they start with a walker, they progress to a cane, and then to nothing. And some patients obviously do fast or recover faster than others. But basically, you stay in the hospital for maybe 2 days, then you go home and you start doing therapy at home and start walking. And basically, it's about walking, getting around, getting your muscles to move like they did before.
That is shocking. Does it shock you that people can come into a hospital and leave with a new hip?
It's amazing. My patients amaze me even now. They come in and they come in 3 weeks out and they're doing so well, so quickly. I don't know that I would do that well. It's pretty amazing.
Thank you, doctor, for coming in. We appreciate it. If you all have any questions about the Oklahoma Spine and Orthopedic Institute at Hillcrest Hospital, give them a call or stop by there at 1120 South Utica Avenue. Call 918-579-5203. You can also go online, okspineortho.com.